As a new day breaks at California's San Quentin Prison, so does a new reality. Inmates describe inhumane conditions amid the coronavirus pandemic.
They're fearful. They're fearful of what can happen.
Lisa King's son is one of those inside the prison's H unit, where offenders have all less than 10 years left on their sentences. In letters sent to KTVU, they describe grossly overpopulated dorms and an inability to keep physically distant.
My son says that they are probably, there's 2 feet between, the 2 sets of bunks. So it's very, very stressful for them.
California's 35 prisons have long been overcrowded. The state houses close to 109,000 people, but the prisons are only designed for 85,000. And at the California Institution for Men in Chino, this is what it looks like inside. The photos were part of an attempt by Prison Law Office to force the state to implement physical distancing and ultimately reduce prison populations during the pandemic.
It's a very dirty environment. It's a stressful environment. It's an environment where there are just too many bodies in cramped spaces.
Kate Chatfield is with the Justice Collaborative, a group concerned about those most vulnerable.
The fact of the matter is there are still hundreds of people using the same toilet, using the same sink, having food prepared communally by people who may be infected.
State data shows nearly half of all prisoners are considered a high medical risk. California has granted an early release to 3,500 inmates. All were within 60 days of getting out anyway. There are no plans to free anyone else. And despite legal efforts, for now, prisoners will stay where they are.
Given the consequences of inaction, I would give them an F.
In late April, prison cases of coronavirus nearly tripled. The first major outbreak was at the California Institution for Men. That's where 9 inmates have died and more than 630 have tested positive.
It's senseless, the deaths that have occurred. I'm going to be honest. They were completely foreseeable and preventable.
The Department of Corrections and Rehabilitation responded here with temporary housing, including bathrooms and showers. In total, 300 inmates have been moved from open dorm settings. Then a second outbreak, this time at the California Institution for Women outside L.A., with more than 125 cases. The state would not provide an on-camera interview, but a spokesperson says everyone is undergoing health screenings, COVID-19 tests, and given masks and hand sanitizer.
I would just plead to them that they can do more.
Back at San Quentin, the cries came in the form of this petition. Dozens of inmates say staying 6 or more feet away from one another is impossible, among other problems.
They're going 3 to 4 days without any hand sanitizer, any soap.
The state says new steps are being taken, including deep cleanings in communal areas every 3 hours. But corrections officials also admit in court filings it cannot micromanage the behavior of every individual inmate.
To be honest with you, I'm terrified.
And for this mom, she's turned that fear into action. Using her fashion degree, she's sewing 100 masks a day and sending them off to California's prisons, hoping it can protect against spreading a virus that has already infected more than 1,200 inmates across the state.
Even if someone made a mistake, they're still a human being. They still deserve to be treated with dignity. They still need to be protected.
Guards and prison staff aren't immune either. State data shows 230 have been infected. Right now, all staff has their temperatures taken before going inside any California prison. The virus arrived by bus last month from a place already experiencing an outbreak. 121 prisoners from the California Institution for Men in Chino were brought here to San Quentin.
It's a concern, man. It wasn't here until it got transferred here.
Inmates describe crowded conditions and fearing for those who are elderly or chronically ill.
I don't want to see them die. And I don't know if I'm tough enough to survive COVID. I don't want to go through that.
But days have turned to weeks and weeks into hundreds of positive cases. Now there's more than 450 infected inmates and nearly 50 staff at a prison that had 0 cases 4 weeks ago.
It makes sense to try and transfer people out to create more space when it's overcrowded. The problem is that you run the risk of seeding another facility if they're transferred into that other facility if they haven't been tested. And that seems to be what occurred here.
Marin County's health officer says testing wasn't done immediately before the transfers to San Quentin, and with a packed prison means isolating to slow the spread is nearly impossible.
We've been super concerned about that setting because we know it's sort of a tinderbox.
No one has died here, but there is growing distress and outrage.
A series of gaffes has led to this outbreak at San Quentin. It was all preventable. They should have listened to the experts, and they didn't.
Assemblymember Mark Levine raised concerns in April. Now he wants an epidemiologist put in charge to contain the outbreak.
It has fallen on deaf ears. I've even talked to the governor about this. We need to have authority in a doctor to make decisions to protect human life.
Inmates say testing began after the transfers arrived, and those prisoners were housed in upper tiers, separated only by bars. Germs and particles, they say, fell on them below and were spread inside. Inmates like Henry Oliver have since tested positive.
They let those guys come out, go to the yard. They have to touch on the metal to walk down the stairs. They use the same shower as we was using. All these obstacles. They're touching everything that we were touching.
San Quentin inmates told us in letters warning months ago of inhumane conditions and grossly overpopulated dorms.
When it comes to this pandemic, they have absolutely no idea what they're doing.
Hundreds of them signed this petition worried about the virus, explaining a lack of personal protective equipment and limited social distancing.
Both North Block and West Block are filled with elderly and chronically ill people. And I just want to be clear, if COVID begins to spread in those units, there will be death.
The state says it is looking at ways to improve response efforts, and inmates are getting masks, sanitizer, and health screenings. So far, more than 800 have been tested at a prison housing at least 3,500.
Another important step is really making sure that they have the capacity at the facility to really isolate people who are cases rather than keeping them mixed with the others. And that's really a challenge in an overcrowded facility like San Quentin.
We are now at a point of crisis.
There is no proactive measures. We are leading behind the ball.
We cannot sweep it under the rug. There must be accountability.
Blasting state prison officials, lawmakers questioned how inmates with COVID-19 could be transferred from a prison in Chino to San Quentin.
In many cases, the tests were 2, 3, and in some cases 4 weeks old. Far too old to be a reliable indicator for the absence of COVID.
It's abhorrent, and I still don't understand it.
But it was also found that deficiencies at San Quentin contributed to the spread. Lack of ventilation, slow testing turnaround, inmates refusing testing, and the layout including a lack of beds.
I don't say this lightly, but this is a failure of leadership.
Right now, more than 1,100 inmates and 112 staff have tested positive. Facts the Secretary for the Department of Corrections addressed head-on.
I need to express, we can do better, and I know we will do better.
The biggest concerns now, insufficient resources to handle the crisis and the capacity of local hospitals to handle the flow of patients. Emergency measures like triage tents and more nurses have been deployed.
The thought that we don't care, or I don't care personally, that's the farthest from the truth. We care about the inmates. We care about the staff.
But lawmakers, advocates, and inmates pushed back, calling for early releases and protection to the thousands of prisoners who are medically vulnerable, many of them over age 55 or nearing the end of their sentences. Alameda County's public defender weighed in.
We're asking you to see them. See them not just as inmates or prisoners, but see them as people. And treat them the same way you want to be treated or I want to be treated.
The goal, they say, is to protect the health and safety of inmates, staff, and the community.
I do not want this to be just talk. I want to see action as a result. The entire state deserves that, is entitled to that, and we will feel the appropriate respect once we see the action.
Free my baby. Free all of them. Just free my baby. Bring him home. I can take care of him.
Pleading for action. Families, advocates, lawmakers, all calling on California's governor to come and see.
The state has a higher moral authority than those it has condemned.
because the coronavirus outbreak at San Quentin has exploded. More than 1,600 inmates have been infected, another 200 employees. 7 prisoners have died, and more are testing positive.
My son's life is important. He's important to his sons. He's important to me. He's important.
The state has released some inmates. Several described to us what it's like inside.
Deplorable, uninhabitable,
scary, dangerous, uncomfortable, unpredictable.
That may be an understatement, because how we got here was a botched transfer of 121 inmates from a prison in Chino. It was already a hotspot for COVID-19. Dozens infected came to San Quentin.
There must be accountability. There must. This is not acceptable in the state of California.
Governor Gavin Newsom called San Quentin a top priority. Tents have been set up, masks handed out, social distancing improved. But letters from inmates paint a different picture.
I'm begging you to see how we suffer. I'm begging you to open up your hearts to compassion and not politics. I'm begging you to hear us. And please, Gavin Newsom, save our lives. We are dying in here.
Sir, can you tell us what it's like in there right now?
Like hell.
But the problems aren't limited to San Quentin. It's become a bigger community issue. Hospitalizations going up, the spread causing a spike, and the cries growing louder, hoping someone will listen.
No man, not one man, woman here is rich enough to buy back their past, but every one of us is entitled to change our future. Let them go.
Across California, there are nonprofit testing labs. Many of them are at public universities, like here at UC Berkeley. But we found with the state's reliance on clinical corporations, there are thousands of what would be free tests going unused.
We are a public university. We're here to serve the people of the state.
There's a shift in focus at the Innovative Genomics Institute at UC Berkeley. With the COVID-19 pandemic, research is happening around the clock, and free rapid testing is offered to vulnerable populations like those in prisons.
If any of the folks in charge of such correctional facilities don't yet have a system for vigorous across-the-board systematic testing, they have to have one now.
Genetics professor Fyodor Urnov, who helped set up the volunteer lab, says that call to prison officials has gone largely unanswered for months.
We wrote to San Quentin, to the folks in charge, and they said, thank you, but we're all set.
That was in April. Since then, an outbreak at San Quentin. More than 2,000 inmates and 200 employees infected, and at least 14 deaths.
I wrote to them again and said, very sorry to hear the news. Is there anything we can do? We will do the testing, and we will do it quickly. And yet again, the polite reply was, thank you, but no thank you, we're all set.
But the state wasn't set, and officials later admitted it in a state Senate oversight hearing.
We didn't have testing resources to conduct the sort of testing that, widespread testing, that would let us do surveillance of how many institutions had COVID.
California is still relying on corporations like Quest to handle testing, mainly because their electronic record software syncs up. But long turnaround times and a backlog of tests make taming the virus difficult.
The virus is out there, and it's an evil and smart little thing. If you give it a window of opportunity to step in, it will go right in and amplify, as we saw with San Quentin.
Health experts who visited the prison in June warned of vulnerabilities, including inadequate staffing to conduct mass swabbing, and slow testing time often returns 6 or more days later.
That's essentially useless. You need to be able to know in 24 to 36 hours, which is what we in this building are able to do.
Urnov says it's critical those infected are immediately isolated, and inmates who are older or have high risk factors are protected.
They mishandled the situation, and they put all of our lives on the line. They put us all in danger.
Recently released inmate Kenneth Larkins became infected and battled the coronavirus behind bars.
Everybody started catching the virus, and they wasn't moving anyone. They wasn't testing people. People was telling the nurses, I'm feeling this way. I'm short of breath. I'm aching. There's no type of medical attention whatsoever.
Lawyers pushed motions in federal court to compel the state to listen to medical experts. Those requests were denied, but a field hospital and 250 healthcare workers are now on site. Still, testing problems persist at all California prisons.
We are aggressively trying to seek greater contracts to provide greater testing at all of our institutions. But as said earlier in my statement, it is difficult to receive and obtain contracts.
We were so eager to help. It frustrates me and pains me that we weren't given the opportunity. It really does.
Because over the last 2 weeks, the state tested roughly 1,500 patients at San Quentin. Ernov says the same number of tests could have been done at his lab in just 2 days.
This is probably one of the worst tragedies that I personally have seen as part of my direct experience. And if we all don't learn and work together to prevent something like this from happening ever again, then shame on us.
There were just so many alarms, up to 10 alarms a day of people going man down.
San Quentin State Prison, the coronavirus taking hold and taking lives.
It was very scary. It was so scary in there.
Lisa Strawn was in for robbery and contracted COVID-19. She survived and was let out early, but 28 others didn't make it.
As far as I'm concerned, San Quentin needs to be shut down because that prison is now a disgrace. It's nothing but a death trap. COVID is not going to stop inside of that prison or any other prison because staff are not being responsible.
Responsibility was called into question this month by California lawmakers.
Are you trying to more rein it in? And well, I'm just saying, because the bottom line, you're the secretary, so the buck stops.
Absolutely.
The buck stops with you.
Absolutely.
Yeah.
Because Inspector General reports expose failures. One shows staff not wearing masks at 23 out of 34 prisons.
It does not appear that the department vigilantly enforced the requirements for face coverings or social distancing during the period covered by our report.
Initial direction was not clear. It was almost a recommendation versus being mandatory. And we've come a long way with that, setting very clear expectations because we take this very, very seriously.
The Department of Corrections says it now enforces mask mandates and will discipline anyone who fails to comply.
That should have been going on a long time ago. So it's just, I'll be honest with you, it's sad, but it's failed leadership.
And lawmakers blasted CDCR on other shortcomings, including failing to screen visitors and staff, using broken thermometers or ones running out of batteries, and providing little staff training.
The thermometer stuff is mind-numbing because you have multiple thermometers there. The battery goes out. You've got spares to do that. So some of the stuff I'm hearing is laughable that people can't get their act together on this.
But inmates say the flaws aren't just outside prison walls.
They weren't changing their gloves. We literally were telling them, can you please change your gloves? That's disgusting.
They're inside too.
From a health perspective, the housing choices available to us within CDCR remain problematic.
Prison health officials say dormitory settings contribute to the spread, but so do choices. Inmates were initially given leeway on wearing masks and still can refuse getting tested or having their temperature taken.
So I'm still trying to understand how in an environment where people really don't have a lot of choices, how this was somehow, people were given a choice. Especially when you had broad authority to tell them you better wear a mask or else.
But they would give you, as an inmate, a choice whether or not you wanted your temperature taken?
You didn't have to. You could refuse that.
Protocols have tightened up, but inmates still make their own medical decisions, and in-person family visits are still forbidden.
Relationships are suffering, they're hurting. It is important to keep families together.
I can't see his face. I can only talk to him on the phone. It's really hard. It's wear and tear.
Denise Pickens' husband is in Solano State Prison, where a busload of inmates were transferred from Folsom. Some had recovered from the virus, others were tested before and then quarantined, raising fears.
I want him home in one piece. I worry. He doesn't want me to worry, but I do.
But even with perfect prison plans comes this warning.
However, I want to be clear that I'm confident we will ultimately see one or more transfers, inter-institution transfers, triggering outbreaks in receiving institutions.
Those transfers typically happen to reduce overcrowding or for behavioral or medical issues.
He really almost died. It was a big scare.
Raylene Arreguin's dad has asthma and caught the virus at San Quentin. Soon he was in the ICU.
He was really in pain. He couldn't breathe. They had him on a ventilator.
It followed a transfer of infected inmates from a prison in Chino, leading to a massive outbreak.
And there's no way possible to social distance in San Quentin. It's too packed in there. Their population is at capacity.
There have been demands and lawsuits to release inmates, even a court order for San Quentin to reduce its population by half. But the Attorney General argues hundreds of inmates could be transferred to other prisons instead.
They don't care. They just don't care. They don't care. Prison is a money-making business.
The state has reduced some overcrowding. So far, 21,000 have been let out.
Currently, our institution camp population is at 94,000. This is the lowest in 3 decades.
Most of them released early and reflecting.
Standing at that front gate, knowing that I should probably be on the other side of that gate, it's just something that doesn't leave my mind. I'm just really blessed.